Vertebral subluxation and spinal degeneration. So a normal spine, in review, should be straight up and down. When you look at it from straight on with the hips and pelvis level and the skull level, when we look at it from the side, it should have these three major curves. We have the curves in the spine to give the spine strength. Between the joints of the spine, we have the intervertebral disc. Now remember that the spine's main job is to protect the central nervous system. This is how the brain communicates with the rest of the body. So you can see that the spinal nerve on this segmental model, the spinal nerve is nice and strong, nice and healthy, and there's a lot of space. So when we look at a normal spine on an X-ray, again, we should see the spine straight up and down, hips and pelvis level, head level, shoulders level. From the side, this, to orient you, would be the back of the skull, and then we've got the three major curves in the spine, again, giving it strength. A subluxation, by definition, is one or more segments of the spine that are out of alignment, that are going to be putting pressure on the nerves and reducing the brain's mental impulse as it flows into the body. So the brain's mental impulse needs to get to all the muscles, organs, and tissues in the body at 100% for you to be functioning at 100%. Your brain controls all the function in the body. Here's an image on the right compared to our normal, textbook normal guy on the left. The image on the right shows massive subluxation pattern and degeneration of the posture shifting forward as well. So for the purposes of this discussion, we're going to be looking at the side view of the neck specifically. So the first image that we're looking at here is the back of the skull, C-shaped curve in the neck. You can see that there's a nice space between each of the vertebrae, which indicates a nice healthy disc. So the picture on the far left is our textbook normal spinal alignment. Second picture, you can see how the posture is starting to shift forward. The ear is starting to move from being above the shoulder to far out in front of it with this forward head shift. You see how the neck is starting to lose its curve, and as a result of that, you're going to be putting more and more tensile forces on the spinal cord. The third picture from the left, you see that the neck is starting to bend backwards. And then finally, the fourth picture showing phase 3 to 4 subluxation, you see the neck is completely bent backwards in the opposite direction. And in fact, this is a case study from my office. 15-year-old female who suffered from 2 years of migraine headaches after a whiplash car accident. And she was taking all kinds of medications to treat the symptom, but it wasn't until we corrected this shift, this major shift in the spine, that her problem was actually corrected and she was symptom-free as a result of correcting the cause instead of treating the symptom. Now we're going to shift into talking about spinal degeneration, and to do that we need to discuss very briefly something called Wolff's Law. So Wolff's Law is a law stating that bone density changes in response to the changes in the functional forces to the bone. And then continuing on, in mature bone, where the general form is established, the bone elements place or displace themselves and decrease or increase their mass in response to mechanical demands imposed on them. What this means is that if your spine is out of alignment for years and years and years, the body is intelligent. It's going to go to work and start laying down more bone around the joints that are under more stress from being out of position. This is an intelligent thing that the body does. However, it's quite irreversible in most cases. So segmentally speaking, this is the example of our healthy segment. Nice, strong, healthy disc. A lot of space for the healthy nerve to travel out. And this is what a degenerated segment of the spine looks like. So we're going to see that the disc space starts decreasing the space for the nerve starts decreasing. That nerve is not as healthy, and we start having these bony spurs forming around the joint. Again, this is what happens as the body remodels itself. Let's have a look at some x-rays. Our picture on the left shows phase 1 degeneration. So the segments indicated in blue, you can see that the spurs are starting to form right in the front part of the neck and even in the back. And this space, the disc space, is starting to close down upon itself. So you can see more normal disc spaces above and below that. Phase 2, the picture on the right. Look at this big gnarly spur that's beginning to form and totally start to close off that opening. Again, what's happening is the body is laying down more bone around this joint because this head has been shifted forward in space for many, many years. Okay. Phase 3, subluxation degeneration. You can see that this is starting to happen at multiple levels in the spine. And even though this person has a bit of a curve in the top part, you can see that the curve is actually bent backwards in the base of the neck. And that is the reason why the degeneration is taking place here. The body is starting to remodel these bones to give it more support around this joint. And phase 4, have a look at this, how several segments of the spine have welded themselves together from being under stress with no maintenance, no proper mechanics, no chiropractic care for an entire lifetime basically. And this person was about 84 when she came into the office. The next example that I have here is a person who was in their 60s, came into the office, was under care for a very brief time, had an initial set of x-rays done, a lot of neck pain. This person works at a desk for 40 hours a week. So the picture on the left, you can see again, a little bit of a curve in the top part, but the head is shifted forward, shifted anteriorly, putting pressure. So when they came in, this person already had signs of degeneration in the lower segments of the spine. If we go to the next picture, you can see how I've outlined this. And this yellow arrow is pointing to some calcification in what we call the nuchal ligament, indicating that there's a lot of pressure and stress back here. And years later, this person came in, and first of all, just look at how white the spine is over here compared to here. So that is decreasing bone density. Of course, there's a DEXA scan, which is the definitive way to measure that. But you can see how the bone density has decreased a lot over the years. And look at these segments down here. So compared left to right, after just a few years, you can see how these bones have continued to just degenerate and completely change their shape and completely start to close off that disc space. And yes, this person had a lot of pain and symptoms in the base of the neck and between the shoulder blades. And then once again, look at the comparison of the calcification of this nuchal ligament. This person came in their mid-50s. So what are we seeing here? A side view of the neck once again. You can see that yes, the head is shifted forward, the neck curve is gone, and in fact, at C4 you're starting to have a bit of that backwards bend where the head is shifting forward at one segment. Now you might look at this and say, I can still see a little bit of disc space in between, but as that's starting to close down, what you don't see in this picture on the right is an MRI of the same person. Now have a look here where the discs are indicated by black. The discs are starting to push back and starting to bulge into the space where the spinal cord is. That's what this indicates. This is the spinal cord, the shadowy area traveling through. So you can see how that's starting to impinge on the spinal cord and the spinal nerves themselves. So what do we want to take away from this? It's important to maintain the health of your spine for a lifetime. You get one spine, just like your set of teeth. If you don't take care of them, they're going to start looking just like that chart at the dental office where you see the decay and the degeneration of all the teeth and what can happen to your teeth. And the same thing can happen with your spine. Now, spinal degeneration, unfortunately, is an irreversible thing. So the younger that you can get things detected and corrected and maintain that for a lifetime, the better off you're going to be. So maintain the health of your spine for a lifetime. Get the segments of the spine checked regularly for a lifetime. Have your family checked. Prevention is always going to be better than reaction when it comes to your health.